If someone has a diabetic emergency, their blood sugar levels can become too low. This can make them collapse. Giving them something sugary will help raise their blood sugar levels and improve their bodily function. Avoid giving them a diet drink as it won't have any real sugar in it and will not help them. Hello everyone, welcome back to Ifechi Health and Wellness. Still on diabetes topic. As we have said before, diabetes is a long-term medical condition where the body cannot produce enough insulin. Sometimes those who have diabetes may have a diabetic emergency where their blood sugar levels becomes too high or too low. Both conditions could be serious and may need treatment in hospital. Go to your hospital or emergency room if you have symptoms of ketoacidosis, such as nausea and vomiting, abdominal pain, deep or rapid breathing. Go, if and you're diabetic, straight to the hospital. Don't waste time. There are signs and symptoms of a diabetic emergency, such as hunger, clammy skin, profuse sweating, drowsiness or confusion, weakness or feeling faint, sudden loss of responsiveness. Make sure that you don't hang around. Take the person straight to the hospital. Hypoglycemia or low blood sugar is a very serious problem in diabetes, and also hyperglycemia where the blood sugar is very high. These two should not be happening. That's why it's very important for you to regularly check your blood sugar before you keep taking your diabetic tablets. And if you have any signs of diabetic ketoacidosis, as I said before, please do not waste time. Any minute or any time lost can be a big deal. Always make sure that you look out for these signs, and always make sure that you are very, very consistent with your checking your blood sugar levels. Don't just keep taking medication because it's been prescribed. I have to take it 2 times a day, morning and night, and you keep taking them without checking actually how is your blood sugar doing. Very important. There are some symptoms of diabetic shock or severe, when it really goes into, from emergency now, it gets into shock or what you call severe hypoglycemia. Some of these are just extremes, but it can still happen. So the things to watch out for are blurry or double vision. The person may start even having some seizures. They might, or seizures, convulsion, they may feel drowsy, very, very drowsy. They may start losing consciousness. Their speech may start, being blurred, slurred speech. They may start having problems speaking. They may become even confused. You see what I mean by diabetes? If it's not properly managed, it can become a big issue. That's why once you are diagnosed, please don't joke with this condition. I hear some people say, oh yeah, my blood sugar is fine today. I don't need to take my medication. No, please. Even if your blood sugar is fine, you can still monitor it. And if it's too low, obviously you don't have to take medication when it's too low. But when it's low today, okay, maybe you withhold your medication, and if you are obviously managing it with lifestyle and diet and what you eat, because if it's regularly managed by what you eat and your lifestyle, your doctor may in the long run decide that you don't need the medication anymore. So before you change anything or stop anything, any medication for diabetes or any thing at all. Even blood pressure, diabetes and blood pressure, sometimes they go hand in hand. You don't check your blood pressure and say, oh, it's fine today. You don't take your medication and you keep going for another week without medication. That's when people have all sorts of problems. And that's exactly the same with diabetes. You may check it today and you think that your blood sugar is normal, and you don't you omit your medication, but make sure you keep an eye, keep checking it on a daily basis, just to make sure. If it's, oh, I'm managing it with diet, that's why it's low, and it's consistent, then that's fine. But always make sure that you still check your blood sugar to avoid this kind of problem happening, this kind of diabetic emergency. Because if this diabetic emergency or shock can actually lead to something else that is more serious, which is diabetic coma. And you don't want to go to that point, because some people, once they go into diabetic coma, it's most of the time they may go from there, or they can be revived based on where you are and the type of hospital and the type of treatment you're receiving. But if you're in a place where the medical services are little or nothing to write home about, then your life might be in a very big danger if you go into diabetic coma. So, but to avoid getting there, look after your health generally. Once you're diagnosed, I cannot overemphasize on this, because the diagnosis of diabetes is increasing. So I cannot overemphasize the fact that once you're diagnosed, don't hang around. Take hold of the whole thing immediately by changing your lifestyle. Yes, if you're taking medication, take medication, but concentrate on changing things around your lifestyle, around what you eat. Carbohydrate is not your friend anymore once you're diabetic. Even if you're not diabetic, cut down on your carbohydrate. I've said that before. Let us take this condition seriously, because it has taken hold of a lot of people. People will collapse, things will happen to people who don't even know why, until you check their blood sugar and you see that actually this is what the problem is. And they have not even been diagnosed in the first place. That's why, please, I keep emphasizing on this. Checkup, investigation, very important. So these are some of the diabetic emergency I want to bring to us today, the signs to look out for and how serious this can be. Please, let's take this serious. Let's take control of our health and of our lives. Thank you all once again for listening. Please share the video if you can, so that others will benefit from what we are discussing here. I'll see you again in my next one. Goodbye and God bless.